You're 75 years old. You're so short of breath, you can't even make a phone call to talk to your doctor. Your heart's failing and your kidneys are failing, nearly to the brink of needing dialysis. And the medications are simply not working. What would you do next? Welcome back to Montgomery Heart Wellness, and we have another clinical round for you today. Today we're dealing with a patient who was 75 years old who had heart failure and kidney failure on the verge of needing dialysis.
I fell sick very badly. And my sister, who's Audrey, she were doing some research. And we come across a lady that was talking about how wonderful Dr. Montgomery is. So she sent the video to me. I said, oh my God, I have to get to this man because this man, only him can do what I want to be done.
She came to us very symptomatic with no energy, out of breath very easily, where she just didn't feel like doing some of the basic things we do every day, some regular activities of daily living. And she came here after hearing about some of the ways we can work with people to help them improve and reverse their illnesses, because she really wanted to avoid dialysis.
I remember her sister referred her. Sister got her on the phone and she was quite short of breath just talking to us on the phone. When she came in, she was very weak.
After he sees my position, he came and asked me what I want him to do for me. I said, I just want you to bring me back to where I was before I reach here. And he said, okay.
We found that her filtration rate of the kidneys was 17. Anything less than 15 is stage 5, chronic kidney disease and dialysis. So she was right there. Then a marker related to heart failure, the NT-proBNP was elevated a little over 3,000. Her marker of inflammation was extremely high.
Two important organs. The kidneys was failing in part because of the heart. Heart's failing in part because kidneys is back and forth play. And as you pointed out, I mean, she was on the verge of dialysis. What I want to point out to the audience is oftentimes individuals whose kidneys on the brink, anything like an infection or some other kind of acute illness can tip you over to needing dialysis or decompensated heart failure, or something as a bad meal. If you had a family reunion or something, or they'll have some fried food or whatever, and that can tip you over. So she was really walking a tightrope when she came.
Right. So the first step, we put her on a meal plan, the raw detox meal plan, and intermittent fasting with that.
Well, the first thing he recommended was the detox meal. And I must keep on doing it, go through that procedure, and that is the key to my recovery. He put me on to Dr. Camille, and she was great. I have never been such a routine test like what I've been through here. In the place of 7 days, every numbers that were low were moving back to the right direction.
We frequently use a blue-green algae and barley grass, as well as other types of green plant foods as strong antioxidants. They also work to hydrate the body at the cellular level. It reduces the inflammation because she had pretty high inflammation. The C-reactive protein is what? And she came at 10.
She was on the diet a few days. We also did give her one single dose of an IV diuretic.
We talk about nutritional, regenerative, and integrative therapies. And so the integrative part is where we integrate the nutrition and regenerative therapies with allopathic medicine. So yeah, we gave her a diuretic to help her out, and that sort of gave her a nice boost. But the diet also helped move her along. Which was the first infusion that she received?
And I believe the first one we did was actually the ozone.
She received it in the form of the e-boost, the extracorporeal blood ozonation.
Right. So ozone is a type of IV therapy. Ozone has 3 oxygen molecules, and it helps increase energy production in the mitochondria, or increase ATP production. It also improves nitric oxide, so it helps improve circulation. It has antimicrobial effects too, and helps modulate the immune system to work more appropriately. So to shift towards cell repair and away from cell breakdown and disease progression.
In our clinical experience, we've treated for a lot of patients with EPO, and typically we see reduction in inflammation. We've seen an improvement in cardiac function in our heart failure patients, and we've been seeing an improvement in renal function in a patient with renal disease. And so this was really right on point for us.
Everything turned around in the place of like 7 days. In the place of 7 days, I was feeling my strength. I was walking better than when I get here. And I couldn't believe how fast I was returning back to health.
Well, even after the first week, actually, we were able to stop one of our medications. So in total, she went from 5 medications to 3. And after the first month, inflammatory marker, the C-reactive protein, went down from 10 to 0.3.
Oh, wow.
She stayed here for about 4 weeks. She came back.
Basically, she's come back to get continued therapy because many of our patients, we put them on like a year-long protocol. So she made remarkable improvement, but she actually wants to do even better.
Her kidney function, one of the ways we measure that is by the glomerular filtration rate, or the GFR, that increased by 76%, which is huge. The Plaque X really helps, but renal function improved faster. Other things with their heart function improved as well, related to the biomarkers, and the ejection fraction went up and normalized as well.
So the BNP went from over 3,000 to like right about
1,000. Yes.
Yeah, and the GFR went from 17 to 30.
Okay.
That's a 76% improvement, which is quite remarkable. Remember, at 17, she was on that border, so now she's got some room in case, let's say, she gets an acute illness, etc. She does have some room in terms of for the kidneys to function. And now that she's getting even more therapy, we hope to get those kidney functions to improve even more. Hopefully even up to normal at some point. So now the patient's back at the center, so she's going for a second round of treatment, get her numbers improved to even greater value, try to get that kidney function hopefully closer to normal. We have very high hopes for her.
Everyone here treat me like we're part of the family. They treated me, they greet you, they're gentle. I said, oh my God, it's as these people seem that they knew me for a long time. People need to come here.
This is a very impressive turnaround. Our patient is very hardworking and dedicated. And again, as usual, if you have any questions, leave them in the comment section. But until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button